Hello beautiful people, welcome back to the channel. In today's video we are going to be exploring different opportunities from different organizations. So we're going to start off with this one you're seeing right on my screen, which is the role of a medical claims analyst / specialist. This position is going to pay about $20 an hour. Again, this position is titled medical claims analyst / specialist, and this position is going to pay about $20 an hour. The minimum offer you can get for this position is $16.23, and maximum is up to $20.57. This is with Presbyterian Hospital. They are offering this position as a fully remote role. So if you have been looking for a while, this is one to definitely jump in to and apply. Like I always say, do not waste time. If you see any role that I post and is of interest to you, go ahead and submit your applications right away, because these roles tend to go very quickly. Fully remote roles are becoming very high commodity these days, so it's very important to apply as soon as you see them. So this position again is a claims analyst role. High school diploma is what you're asking for, and this is open to every applicant in the United States, right? Except the following states. They only talk about Ohio, Wyoming, and North Dakota, but every other remaining 47 states are eligible to apply for this position. So it's a fully remote position. High school diploma is all they're asking for, and your work hours are during the day. We offer a wide range of benefits. It talks about what they offer. Retirement plan is part of their offering. They also offer vision, dental, PTO, etc. With this position, high school diploma is what they need, and data entry is a big part of this role. So they are looking for people with data entry experience with a typing speed of about 45 words per minute. It's preferred, so it's not required. So even if you don't type up to 45 words per minute, you can still apply. So this position also is looking for you to have some experience in claims processing. It's also a preference, so it's not really required, but if you have any type of training or experience in claims processing, it's highly desirable for this role. They also talk about being able to process hospital and medical claims according to quality and production standards, online resources, policies and procedures that are available are kind of a guide for you as you embark on this role. So that is more around responsibilities. So this position is open right now and is accepting application. And from my research, typically Presbyterian will provide you all the equipment you need to work from home. So it's important to keep that in mind. I do want to call that out because I know that's something that could be concerning for folks, but they do provide you with that, because they are also very concerned with HIPAA. So it's important to them to give you equipment that they have access to easily and also have some control over. So that's why they are providing you with their own equipment for you to use. So that's the first position. And then the next position right here is this one, right, which is titled Benefits Operations Specialist. This is with Talent Table. So Talent Table is looking for someone to come on board, fully remote, and this is a contract position, is a 12-month contract position, is for 1 year. And with this position, you can expect to get an hourly rate of about 34.48 cents per hour. So this is W-2 plus paid holidays. So they do pay you for holidays. And this happens sometimes, you know, it's very important to check all of this. Oftentimes contract roles may not pay you for PTO, or they pay you. You want to make sure that you clarify all of that, especially if you are going into a contract position. This is for 1 year, by the way. And with this position, you're going to be providing day-to-day support for all things benefits. You're going to be ensuring that all questions from employees are answered. Any type of questions that you're unable to answer, you escalate them to leadership to get the proper response for the employee. So that's really it. It does talk about having some familiarity with Jira Cloud, some tracking or ticketing systems, also having some knowledge around Google Docs, Microsoft Office, etc. Someone with a strong analytical and problem-solving skill set, making sure that, you know, we get things right the first time. Accuracy is very important, and then attention to detail. So that's really about it. And I've already shared with you what the salary is, also shared a little bit about the role, so, and also the requirements for this position, right? So that is it. So we're going to move on to the next position. The next role is titled Scheduling Coordinator, and it's with this company called Inovage. Inovage is a company that does most of scheduling and coordinating consulting for different organizations. So they will hire you for you to help them provide those services to whatever their clientele is. So that's really it. And they are looking for a scheduling coordinator to kind of help in performing receptionist type of duties, helping to schedule meetings, helping to coordinate meetings, helping to make sure that conversation that needs to happen between providers and participants or members are happening, kind of helping to facilitate information sharing, information gathering, etc. With this position, it talks about being able to provide information to participants, people seeking care, patients in this case, also helping to schedule appointments as needed, helping to schedule follow-ups for patients, and also coordination of care between providers and patients. So that is really primarily what this role is. The requirements, they're asking for 1+ year administrative or clerical experience, 1 year of scheduling experience, some knowledge around EMR, electronic medical records, or medical terminology. So that's really all they need for this role. So they do have a list of preferences here as well, which kind of still falls within that bracket. The only thing that is really different that stands out is the potential of someone having some nursing background. They are very interested in that as a preference. And so if you're a CNA, they will definitely consider you highly. However, doesn't mean that if you don't have that, they will not consider you at all. So everything is based on what you're bringing to the table, what are your previous experiences, and how does that sort of fit into the team they are looking to plug you in. So that's really it. Again, remember, these roles, I am going to be providing direct links to them in the description of this video, so you can go straight to each of the roles without having to scroll and come up with what the URL is. I think that's really important, so I'll be making sure to include that in the description so you can go straight into the different links. So with this position, it's $18 minimum and maximum is $20 an hour. That is this role. The next position that I have on my list is this one with Eocene. They are an environmental group, and they have a position open right now titled Data Management Specialist. With this position, they do have several locations scattered around the United States. For this particular role, they are looking for you to reside in California to be eligible for this one. Though it's fully remote, but they do need you to reside in California because of occasional visit to the work site for meetings or other engagements. The requirements, you're looking for somebody with a minimum of 2 years experience working with computers. So they just want to make sure you're comfortable. Data entry experience come in handy here as well. Customer service is good. They also talk about being able to have a grasp of different computer systems. That is also a plus here. They also talk about being able to work very independently, which is definitely another to keep in mind. But overall, that is really what this position is. The next position is this one right here with DataVant, titled Health Information Specialist. I've done DataVant in the past, and they are leader in the data exchange world in terms of healthcare. So they continue to thrive there. They continue to do a whole lot there. So they're looking for somebody to come on board as a health information specialist. You're going to be coming on board to provide support, specifically in the area of requests for patient information, to make sure that any type of requests that come in are legit and they are legal, all requests, and also that none of them are violating any HIPAA rules, etc. So really, really essential. With this position, they talk about receiving and processing requests for patient health information. They also talk about being able to maintain confidentiality. They also talk about someone who's able to answer the phone, make calls out to members, etc. Able to assist with other administrative type of tasks, also helping to maintain the patient health records, keep the system up to date, keep everything as accurate as possible. that is something that is on the list here too. High school diploma is what they need. Someone who's very good with computers, to able to navigate yourself around the computer. Someone who also has some data entry experience. They do have it as strong data entry experience, so really essential. And the salary for this is between $15 and $18 per hour. Again, $15 to $18 per hour is the salary range. The next position is this one right here, which is titled Care Coordinator, TRICARE. So these are the places. They say we offer remote work opportunities for all of these states. They're right here. This is not open to the entire United States. However, it is open to a significant amount of states as well. So really important to go through that states and make sure. Required, talk about LPN, U.S. citizen, someone who's very proficient in medical data entry, written skills, Microsoft Office. Preferably, they want someone with 3 years of experience and 3 years of managed care experience. Managed care experience, in this case, health insurance. So they want you to have that type of experience, which makes sense, so as to help navigate issues that do come up in a pharmaceutical setting. So they have all of that. They are in need of all of that. So with this position, right, you are going to be doing a lot of liaising, a lot of collaboration between clinician in-house and also pharmacists outside of the office to ensure both sides are communicating as they should, to ensure that the patient is getting the best of both sides and also the best of just healthcare in general. Then the last position I do have is this one with HealthEquity. This position is titled Member Service Specialist 1. It says our mission is to save and improve lives by empowering healthcare consumers. Come be part of this remarkable adventure. So this position is really focusing on members. One of the things I do like about this is that they do provide you with training. So you are not just thrown into the job. You are trained before you even begin. This is a remote position. It says it right here. It says shift times 10 a.m. to 6:30, 11:30 to 8 p.m. all mountain time. So they do seclude this, right? Made it exclusive to these particular states. So you do need to reside in any of these states to be eligible. However, all my subscribers that are out there that lives in these states, I encourage you to go ahead and submit your application. It says this opening is for our March 3rd training class. So all applicants must be available for training between March 3rd to 28th. That is the training schedule. And what they need for this is high school diploma or GED. They also want you to be at least 18 years of age. 1 to 2 years customer service experience is a plus, but it's not required. They have PC navigation, someone who's able to again navigate computers, someone who has strong oral and written communication. So that's really it. This is the last position I have for this video. If you have any questions, please come back, leave it in the comment section. Subscribe to this channel if you've not subscribed already. Till next time, I wish you all the very best of luck, and I will catch you in the next video. Take care, guys. Bye-bye.